Welcome to today's Explainer, where we're unpacking a literal game changer in human history, the absolute life-saving power of antibiotics. But we're also going to confront a really urgent growing threat that comes from misusing them. I mean, we rely on these medications to survive everything from, routine surgeries to incredibly severe illnesses. But their future effectiveness, well, it's really not guaranteed anymore.
So think about the last time you were prescribed antibiotics. Did you actually finish every single pill in that bottle? Or did you maybe stop a few days early just because your symptoms faded? It's a surprisingly common habit to just stop when we feel better. But doing that actually has massive global consequences. What feels like a totally harmless personal choice is literally training bacteria to become stronger and a whole lot deadlier.
Okay, here's our roadmap for today. 1. Meet your microscopic defenders. 2. How antibiotics actually work. 3. Bacterial versus viral infections. 4. Side effects and interactions. 5. The threat of resistance. And finally, 6. Protecting our life-saving medicine. To show you just how universally relevant this whole topic is, consider this number. In the US alone, healthcare providers wrote over 211 million prescriptions for oral antibiotics for outpatients in 2021. That's roughly 636 prescriptions for every 1,000 people. We're using these medications on just a monumental scale, which is exactly why understanding how they work is absolutely vital for our collective health.
Let's dive into Section 1. Meet your microscopic defenders, the life-saving benefits of antibiotics.
Normally, your immune system's white blood cells are pretty great at fending off harmful bacteria before they even cause symptoms. But when a bacterial invasion is just too overwhelming, antibiotics step in as your crucial reinforcements. From clearing out stubborn infections and easing those awful symptoms, to literally saving lives and stopping the spread of disease to the people around you, their benefits honestly cannot be overstated. They are the frontline defense keeping a simple cut or a bout of strep throat from spiraling into something life-threatening, like sepsis or rheumatic fever. And what's really fascinating is that doctors don't just use them to treat active illnesses. They frequently rely on prophylactic antibiotics to prevent an infection before it even gets a chance to start. So before major surgeries, complex dental procedures, or right after a high-risk animal bite, these preventative doses act as a literal protective shield. Moving on to Section 2, how antibiotics actually work, the mechanisms of action against bacteria. So once these drugs enter your body and hunt down the harmful bacteria, they basically use one of two main attack strategies. Bactericidal drugs, like penicillin, they're the assassins. They completely wipe out the invaders by destroying their cell walls or their DNA. On the flip side, bacteriostatic drugs act more like a containment crew. They pause the bacteria's ability to multiply by blocking essential proteins. That basically buys your own immune system the critical time it needs to sweep in and finish the job. To pull off these strategies, doctors rely on a whole arsenal of different drug classes. Think of it kind of like a wardrobe, right? You wouldn't wear a tuxedo to mow the lawn. Similarly, a doctor picks a specific class from this wardrobe to target your exact infection. Classes like penicillins, which includes amoxicillin, or tetracyclines, like doxycycline. They all have a highly specific chemical structure that is custom-tailored to fight specific types of bacteria. Now for Section 3, bacterial versus viral infections, knowing when to use the right tool. Here's the thing. Antibiotics have a very specific blind spot: viruses. Taking an antibiotic for a viral sinus infection or the flu is honestly like putting a bandage on a sunburn. The fix just totally misses the problem. Viruses operate completely differently than bacteria, so antibiotics are strictly 100% reserved for bacterial infections, things like strep throat, bacterial pneumonia, or UTIs. Section 4. Side effects and interactions, the complication to the cure. Because these medications are powerful enough to literally destroy cellular structures, they inevitably bring complications. Now, while diarrhea or nausea are pretty common nuisances, and healthcare providers often suggest using probiotics to help restore your gut health, antibiotics can sometimes trigger much more severe conditions. We're talking yeast infections from candida overgrowth, dangerous bowel inflammation caused by C. diff, or skin rashes that could actually signal a developing allergy. And remember, antibiotics do not exist in a vacuum inside your body. You should never mix these with other medications, supplements, or alcohol without checking with your doctor first. Certain antibiotics can interact incredibly dangerously with blood thinners like warfarin, your everyday antacids, and even NSAIDs. And mixing some antibiotics with alcohol, that can trigger unexpected severe reactions and cause some real liver damage. In rare cases, someone might experience anaphylaxis, a sudden, life-threatening allergic reaction to an antibiotic. If a person starts getting facial swelling, trouble breathing, or sudden, severe itchiness, you have to act fast. If they have an EpiPen, use it. Dial 911 immediately. Lay them down safely on their side if they're vomiting, and whatever you do, do not leave them alone until help arrives. Quick action here literally saves lives. Which brings us to Section 5. The threat of resistance, a global public health crisis. Alexander Fleming, the man who famously discovered penicillin, literally predicted this exact crisis all the way back in 1945. In his Nobel Prize acceptance speech, he warned that underdosing or misusing his discovery would expose bacteria to just enough of the drug to train them, rather than kill them. He knew back then that we could easily end up teaching our microscopic enemies exactly how to defeat our greatest medical weapons. And, well, his warning has absolutely come true. Antibiotic resistance is what happens when bacteria adapt and evolve. When we use broad-spectrum antibiotics when we don't need to, or we stop our prescriptions early because we're feeling a little better, we kill off the weak bacteria but leave the strongest ones behind. Those survivors learn, they adapt, and they multiply. They basically become like stubborn carpet stains that just won't come out no matter what chemical you throw at them. This constant misuse creates terrifying superbugs like CRE. These are bacteria that have become highly resistant to carbapenems, which is a major class of our last-line defense antibiotics. And this is a massive, massive crisis in hospitals right now. When our absolute strongest antibiotics stop working, simple infections turn lethal, diseases spread faster, and thousands of lives are put at severe risk. Finally, Section 6. Protecting our life-saving medicine. Proper usage and calls to action. The good news is we can combat this resistance directly. Every single time you take an antibiotic, take it exactly as instructed and finish the entire course, even if you feel 100% cured on day 3. Never save pills for later, never share them with a friend, and safely dispose of any leftovers. By sticking to this, you ensure that no surviving bacteria get the chance to learn and adapt. Antibiotics are undoubtedly a modern marvel. They've revolutionized human survival, eased terrible symptoms, cleared deadly infections, and given our immune systems the backup they so desperately need. But I want to leave you with this final thought. Your daily choices dictate their future. Are you using them responsibly? Because the actions we all take today will decide whether these microscopic defenders will still be there to protect the generations to come.